Welcome back. This is Dr. Olush again. You might have seen my last video on what are hormones. Today's topic, we're going to be talking about why do we need to replace them. What is the basic thing you need to know about replacing your hormones? So, what is hormone replacement therapy? If you've not yet subscribed to this channel, you need to do that right now. Click that notification bell so you don't miss my next upload. And I also want you to join my secret VIP free group. Click the button below to join, okay? That is where I talk about things that I can't talk about on YouTube. And trust me, those are hot topics, okay? All right, let's get into today's topic. Hormone replacement therapy. There is so much division in medicine about this topic. And it's like everybody needs to take a side, okay? It's either you're for it or you're against it. And then, well, maybe in the middle is those that just don't know about it, okay? But I don't want you to be one of those, so we're educating you about it today. But almost everybody has to take a stand on whether they believe hormones should be replaced or they should be left alone, okay? So let me share with you what is hormone replacement therapy. And if this video allows, I would even go into my story of how and why I started replacing mine very early, okay? So, what is hormone replacement therapy? If you haven't watched my previous video, I definitely encourage you to do that because it explains what are hormones in the first place. Why do we need them? What are they? And so on. Hormone replacement therapy is the process of us, meaning the medical doctors or professionals, giving you a prescription or sometimes stuff you can buy over the counter to increase the amount of hormones that is in your body because you have started having certain symptoms that make us know that those hormones are low. So how do we even get to this point? Okay, so let me share with you really quick. Average female, okay? You're born and immediately you have a limited number of eggs that is going to be in your ovaries. And those eggs at a certain age, which we call puberty, will start to release one every month. And the process of releasing hormones from those ovaries is very complicated, which we'll probably discuss in another video. But the idea is that every month, those follicles that you release, or egg that you release, were released so that maybe it allows you during the reproductive years to be able to get pregnant and have a baby. And there's certain surges that we expect, right, during those months that help you to prepare your uterus for that implantation. So you're going to have a certain time of the month where the estrogen starts to surge. Following that is going to be your progesterone, and the ratio of those hormones, as well as the FSH and LH, which I also talked about in the previous video, will determine whether you're going to have a baby, not have a baby, you're going to have a bleed, not have a bleed. Okay, so we won't go into the details about that, but just understand that each month that's happening for a female. And when you get to a certain age, and we're now finding that that's somewhere around age 35, the amount of hormones that you are releasing starts to dwindle. So you start to lose the amount of eggs that's in those ovaries. And it gets to the critical point where eventually you're not releasing enough to sustain the daily function that your body needs. Okay, I hope that makes sense. So you are releasing hormones every month, and then when you get to a certain age, the ovaries is just not able to keep up with the demand. Okay, so we call that age menopause, right? It means that our menses pauses, okay? Why does the menses pause? Well, because the hormones that cause that bleeding every month have dwindled to the point where it's not able to do that anymore. And for a lot of us, we think, oh, thank God, that painful monthly thing, I'm glad that's over. Yes, but what that also means is that all the benefits that come with those hormones every month are going in their way with it. So what are those things? Well, those hormones help you sleep better. For example, progesterone. It helps you get into deep REM sleep. Well, those hormones help you keep body fat down. Guess what? Testosterone when you start losing it to a certain degree, well, you start to pack on the belly fat. Why? Because testosterone was one of the things that was helping you keep that fat down. Okay, well, what about the estrogen? Well, once we start losing that, we see our skin is a lot drier, we're wrinkling, we have vaginal dryness, we have painful intercourse, and so on, right? So all the symptoms start, we start feeling irritable, our mood is off. So because of this, we really don't enjoy the fact that the period stopped, because now we have all the symptoms that have come along. So I usually tell my patients that, just think of menopause as a signal that your body is giving you that, hey, I need some help around here. I've been working for the last 30, 40, 50 years, and I've kind of given you all I got. So maybe you want to help a sister out? Okay, so think of it that way rather than, oh, it's celebration time, period has stopped. Well, period stopped, yes, but now your body still needs these hormones to continue to do all those things I just mentioned and more, right? Because like I said in the previous videos, these hormones are very important for well over 100 different functions on a daily basis. So how would you now function past 50 when you don't have any of those left? So this is why we need hormone replacement therapy, okay? So what do we do at this point? Once we now realize, oh, this stuff is important, right? In the case of men, well, you don't cycle like women, but you still dwindle. Your hormone levels start out at a certain high point once you go into puberty, right? And then from there is a certain rate of decline every year as you age. It just keeps going down. So we know, for example, men's testosterone level can range anywhere from like 300 to 1200. Well, 1200 will be closer to like, the teenage years, and 300 will be closer to your 90s. Okay, so you can range anywhere in that. So, and for everyone, we just have to realize that, well, whether you're male, female, doesn't matter, hormones are going to dwindle. And when they dwindle, so does the things that they normally help with. So in the case of a guy, you start to feel more tired, your body aches, you don't feel the motivation you used to feel, you start packing on the belly fat just like the women, right? You start noticing like, what is this male breast thing going on here? Because the ratio of your testosterone and estrogen is now off. So a lot of these different things starts happening. You start getting bald, just name it, right? So there's a lot of things that start happening once we start having this imbalance in the hormone levels. So this is why hormone replacement is important. Now, how we replace it and what options are out there, we're going to talk about on the next video. So you don't want to miss it. Click that subscribe button if you haven't done so already, and join my VIP free group. I'll see you then.